Welcome to Connecting with the Toms podcast. I'm your co-host, Julie Tom, a trauma-informed movement specialist.
I'm Dr. Dick Tom, a biological medicine physician. We wish to share the untold truth about health and fitness industry based on our combined 70 plus years of experience. We want you to connect and feel empowered in your own mind and body by interacting with each other.
This show is about connection for you, for us, and for the world. This is Connecting with the Toms podcast. Let's start connecting.
Welcome to another episode of Connecting with the Toms. I'm Julie, your co-host.
This is Dr. Tom.
And today we're going to be talking about we actually had a listener ask us, write in and ask us to discuss this particular topic of menopause. And she's been struggling with menopause belly. And she's done many, many things to help try to support her symptoms and her hormones, from walking to nutrition to everything that, that most people can Google. But I said, you know what? I think this would be a great topic for us to discuss. So because I know, Dad, you've worked with a lot of patients who might have had this same issue. So how about you give us some tips and tricks on what is happening when women are going through menopause? Let's start there. So what is happening in the body when women are going through menopause?
So this obviously is an incredibly extensive topic. I'm not here to basically share and tell you that I have all the secrets and I have all the answers for women who are going through menopause. However, I will share some ideas and thoughts that hopefully you may not be aware of, no matter what you have read or what your doctors have told you, or what your mother told you, or what your next door neighbor is telling you about menopause. And when we compare this to women in the westernized world versus women in, we'll say the third country world, is there any difference? And what is menopause? And is menopause an illness, or is it a natural transition that women go through at a certain point in their life? And from the aspect of straight physiology, what does it mean? Women, typically will develop menarche, all varying ages now, literally from as young as 10 to, we'll say, 16. We'll say 12, 13 is probably the average age that women start a menstrual cycle. And the starting of a menstrual cycle basically means that, a woman becomes fertile and on a monthly basis, hopefully, she has the opportunity to become pregnant and bear, a child. And then, after several decades, we'll say 3 or 4 decades, there comes a point where the body says your cells are getting older, your ovaries no longer have adequate numbers of eggs, and believe it or not, the eggs that a woman has are literally from the time of we'll say puberty. She doesn't make more; they're all there, and so the eggs of a 19-year-old are, we'll say, a little healthier than the eggs of a 47-year-old, which is why, as a woman ages, it becomes more difficult to get pregnant, because the cells, unfortunately, and the eggs have been there for all those decades and have been therefore exposed to everything that the woman has been exposed to, be it from her nutrition, be it from her environment, be it from smoking, be it from chemical exposure, whatever it is. Those particular cells have been exposed throughout, as has every other cell in our body. So the simplest aspect is the amount of, we'll say, the female hormones, estrogen and progesterone, although that's a misnomer because men also have estrogen and progesterone, just not obviously to the same level. Testosterone is also an important number. So what ends up happening, and at least in Western society, is about age 49. Years ago, we'll say a few decades ago, it was closer to 52. So it actually has decreased about 3 years or so on average in the last 3 decades. in general. So that by itself is telling of something that's going on. Unfortunately, that may become even more of a problem in the decades ahead. We've just gone through, a very destructive and very unfortunate pandemic of COVID, where that has had, some changes. And I just read this week that there is now research that definitely has shown that women's menstrual cycles have changed as a result of COVID, both the illness and the vaccines. It didn't say specifically, they're just saying that women's menstrual cycles are different now in a sort of, we'll call it a post-COVID era. So what ends up happening is that estrogen normally is you have two peaks of estrogen during a regular menstrual cycle, and then which happens around ovulation, which we'll say is around mid-cycle, and then there's another peak, we'll say about day 20, 22, more or less. It's a smaller peak, and then we have a peak about day 22 of progesterone also. And then if the egg does not get implanted into the uterus by day 26, 27, 28, then we have a dramatic drop of the level of progesterone. And then we have the shedding of the lining of the uterus, and we have a so-called normal menstrual cycle. So it is assumed that, when a woman no longer menstruates and therefore is in menopause, that she doesn't have estrogen and progesterone and she's not cycling, which actually is not true, because a woman will continue to cycle for about 5 years after the actual last menstrual bleed. So if 51, or excuse me, if 49 is now perceived to be the average age of menopause, and by menopause, the medical definition is you haven't had a menstrual cycle or a menstrual bleed for 1 year. So women go into this perimenopausal phase where, where all kinds of funny things happen. Maybe you get two periods in 1 month. Maybe you get bleeding for 2 weeks in a row. Then you don't have a period for 3 months, and then you have spotting, and then 4 months later. So when you go through a period of nothing has happened for a year, by definition, you are considered menopausal. However, we do know that you do continue to cycle your estrogen. You do continue to cycle your progesterone. However, it's not to the same level where enough estrogen causes the thickening of the uterine lining to be ready to implant an egg, and then the amount of progesterone is not adequate to cause a shedding at the end of the month, we'll say. However, the cycle is still there, and if you were to measure it, which obviously has been done over a period of time, and you take the units away from the graph that's being done to follow this, you wouldn't be able to tell a woman whether she was menopausal or in this 5-year period. So therefore, my belief is that because we basically support women's menstrual cycle with the cycling of seeds and essential fatty acids, we continue to do that pretty much on a basis following the new moon and a full moon, and until basically the calendar says that we're 5 years post, definitely post menopause. Now, even after the 5 years, what has been found is there isn't enough you're still making estrogen and progesterone, not from your ovary, however. Now it's being made from your adrenal gland. And so my clinical observation is that for women who are not yet in menopause or not in this perimenopause phase, what I suggest is we have to do everything we possibly can to support the two organs that are going to take over the job when your ovary no longer is capable of making adequate levels of estrogen and progesterone to cause the thickening of the lining and then the sloughing of the lining at the end of the month. And those two organs are your thyroid gland and your adrenal gland. It is well documented and well accepted in menopause that or in thyroid conditions, that the number one cause, so-called, it's not a cause, or the number one period of low thyroid is in menopause. So what ends up happening is that the thyroid is asked to do a little more work. So if you think of a triangle, and on one angle you put the thyroid, another corner you put the adrenal gland, and the other corner you put the ovary, you no longer have the opportunity that the ovary is doing its not adequate to do its job to produce these hormones. So therefore, two other organs, the adrenal gland and the thyroid gland, are now responsible for trying to maintain the work of three glands, but now we only have two glands. So the thyroid does not make estrogen and progesterone. However, the adrenal gland does. In fact, the adrenal gland makes 31 hormones, of which estrogen, progesterone, testosterone, aldosterone, and cortisol are 5, but we got a whole bunch more that are also part of the picture. So therefore, leading into the perimenopausal phase, if we can in fact strengthen adequately the thyroid gland and the adrenal gland, I say that what's supposed to happen, and on rare occasions I do see a woman where this happens, what's supposed to happen, and it happens in other parts of the world, is you have a menstrual cycle, and you're in your third or fourth decade of having a menstrual cycle, and then one day you don't have a menstrual cycle, and you never do again. In other words, it just stops. And it's not a transition. It's just literally you menstruated, and then the body says, I don't need to menstruate anymore. I'm out of this phase of needing to procreate. And other women will now be their responsibility. We'll say, to procreate the survival of the human species. And so those women, when that happens, menopausal symptoms, they say, well, what are you talking about? Did your has not been capable of kicking up adequate levels of these hormones? So of course, what happens in society, what happens when you go to the doctor, he says, I got the solution for you. Look, we're just going to give you some hormones. We'll give you some estrogen. We'll give you some progesterone, and you'll take your symptoms away. And so, and it will, and it does a wonderful job of doing it. And women say, oh my God, my energy, my sleep is so much better. My energy is better. The vaginal dryness isn't there anymore, et cetera, et cetera, et cetera. So what it looks like is the solution for menopause is to take a pill, which of course is not the way the body is supposed to work, because the body is supposed to be able to maintain adequate levels of hormones throughout our entire life, even in a post-menopausal phase. So what we look at, and what I look at clinically, is how do we? And I'm not going to say women should not take hormones. My own personal preference is that if women are taking it, that's fine. You can continue to do that. However, at some point, you're still going to have to support your thyroid gland. You're still going to have to support your adrenal gland in order to basically one day hopefully get off it, because doctors are saying, well, you shouldn't be taking these hormones longer than about 5 years, because unfortunately we know that there is an increased risk of breast cancer also, potentially. It's not the only cause, and I'm not saying that these hormones cause cancer, but we do know that if you do develop breast cancer and are taking hormones, the first thing that you're done is stop the hormones. So the medical profession definitely knows that somehow there's a correlation, because with breast cancer, are you estrogen positive, are you progesterone positive, et cetera, et cetera. And then if you're taking these hormones, the assumption is somehow that is going to potentially be a triggering factor in cancer and the management of it. We don't want women basically continuing to have high levels of estrogen or estrogen if they have positive receptor sites in the cancer cells in general. So that's a whole other topic itself. So what we're doing is we're support the general support, with because you're not having a menstrual cycle, we're alternating for 2-week periods. So from the time of the new moon, or day one of the menstrual cycle when you're still menstruating, we're having women take flax seeds or chia seeds or hemp seeds, a couple of tablespoons of ground seeds through the day. In addition to that, we're having them do essential fatty acids, specifically fish oil or flax oil, to provide those specific nutrients. And then at the time of ovulation, which hopefully is about the middle of the cycle, we'll say day 13, 14, 15 in a sort of regular cycle, a regular menses, or at the time of a full moon, which is when the moon is bright in the sky, we basically switch the seeds more to sunflower, sesame, or pumpkin seeds. And what I generally do now is we decrease the amount of fish oil or flax oil that they're taking, and to about half, and we add evening primrose oil or borage oil. And what we're attempting to do is to mimic or support the body's known cycling as far as estrogen and progesterone is concerned, to mimic the cycle itself. At the same time, of course, we're supporting the thyroid gland, the ways that we do it, which is a whole other topic, and we're definitely supporting the adrenal gland, and we're doing that either with nutritional support, or the most important thing with no matter for everybody, including with little babies starting at birth, to normalize adrenal function, is to have a routine and schedule. So a schedule for us means we more or less get up at the same time, we more or less eat our meals at the same time, and then we more or less go to bed at the same time. So those factors of meal times, wake, and to bedtime are one of the most critical components for helping to balance the adrenal gland. And if it's done on a regular basis for years before, and we do, whatever other support, manage stress, etc., whatever that means for people, women can do a pretty easy transition through this perimenopause menopause phase. So hopefully, that's not so overwhelming as far as what theoretically is happening. And so the initial question that came from the listener was, what about this menopause belly? So, what is that? In my experience, generally what that is that's increasing insulin. That is becoming insulin resistant. And so what I do on a routine basis for all my patients is we actually measure their insulin, fasting insulin. Insulin is, of course, something related to blood sugar. And, people hear about it. They may know about diabetes, or they may know about hypoglycemia. And they don't pay it. Most people have no idea what their insulin level is because their doctors never measure it. And in fact, they may measure their fasting blood sugar, and hopefully they'll measure their 3-month average of their hemoglobin A1C, which is a hint of what's going on with your blood sugar. And what we're finding and what we have found is that as the estrogen and progesterone become less efficient, we'll say, or you don't have as much of it, and you're being asked by the adrenal gland to increase the levels of estrogen and progesterone. But the adrenal gland says, whoa, 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 whoa. He said, you've basically, for the last 50 years, you haven't really been taking care of me, and I have been trying to help you manage your stress. So I'm still trying to manage that. So I'm making all these other hormones, especially cortisol, because that's your stress hormone, or one of your stress hormones. And I don't have enough time or effort or raw materials to make these other hormones. So you're just going to have to suffer through this, and that's going to be the way it is, and too bad for you, type thing. So what we're attempting, and one of the functions of cortisol, because now the body is under more stress because you're not sleeping as well, and when you don't sleep well, you get more irritable, and then you start to have these other symptoms, which further increases your stress, which further increases your cortisol level. Now, one of the functions of cortisol is to maintain your blood sugar. In fact, your blood sugar, even if you don't eat, cortisol will be produced to literally to convert different tissues in your body into sugar, because the brain loves to mostly function energy wise on glucose. It can burn fat in a pinch, but for the most part it will prefer to burn glucose. And glucose, people think it's sugar, table sugar, white sugar, and they always say, well, I don't eat sugar. I said, no, we're not talking sugar. We're talking carbohydrates, because carbohydrate. So whether you eat a piece of bread or a pasta or a pizza or anything sort of on that realm, or even legumes that are carbohydrates, because it's a fuel for the brain. And what's happening then in time is that this extra glucose causes the pancreas to start making more insulin, and so our so-called fasting insulin starts going up. And the other name for insulin is called the fat hormone. And so when we have literally more sugar in our blood than what the body requires at that moment, if you're running a marathon or something, it needs it in the blood. But generally speaking, we're not running marathons. We're just going about our everyday life, unfortunately becoming more and more sedentary in time. And so the body at that point realizes, it says, well, we got all this extra glucose hanging out because of all this extra stress, but I don't really need it because I'm about to go to sleep. And so what we find is that their fasting morning glucose, or excuse me, their insulin isn't 5 or 4, which is what at least this is. And I apologize because I can't think off the top of my head what the number is in Canada. It's the metric system. So anyway, we do it, and I just did one last week, and it used to be 7 or 8, and the last number I just ran was 25. It's like, whoa, where did all that insulin come from on a fasting level? Well, it's because the body thinks that this sugar is going to be high, so it's puts all this insulin into your body, and then when it realizes that you don't need it for energy, it literally does. Guess what? Puts it into fat. And this is what the menopausal belly becomes. So when we look at the menopausal belly, I basically look at insulin levels, and I look at another hormone called leptin, which has to do with fat and fat metabolism. And so, we do that type of a metabolic assessment. And generally, what we end up then doing is following a diet, following a program that basically is an attempt to lower insulin levels so that we can get the body to realize that it doesn't need to maintain this high level of fasting insulin. And but everybody sort of knows, who knows anything about diabetes is concerned, what every doctor has always said is, if you lose 10 pounds, your blood sugar will be better controlled. If you lose 20 pounds or 30 pounds, and many of these people are taking insulin to try and control their blood sugar. And so we have two things which almost invariably will not allow anybody to lower their insulin levels. One is if you're taking it, unless we do much better control of your blood sugar itself. But more importantly, in my experience, no matter what somebody does, short of starvation, it is impossible to lose weight until you balance these hormones in the endocrine system, being the thyroid and the adrenal. Because under stress, your body, your brain will keep shoving out more and more cortisol and saying, we're not going to have you lose weight because this, we're going to put this. And why is it always in the belly? It's in the belly because the body has made the assumption that, well, it's right next door to your intestinal tract, and if it's right next door to the intestinal tract, if we need to somehow break this fat down quickly for fuel, it's right where all this digestion is supposed to take place. So that's my opinion, that's why it happens to be there, as opposed to why isn't it in your thighs? Although sometimes it is, or why isn't it in the back of your arms or in your back or your feet? Well, because those are too far from the site that these uh, it would ultimately be broken down and utilized quickly, which is what the body needs in order to supply necessary fuel. So that is probably too long a discussion or too long a conversation about just the simple answer to the question. But what hopefully you got is, it's not a simple answer of, oh, just go to Weight Watchers or do some special diet and you'll lose the weight. The first thing when somebody asks me about weight, a belly, or is like, how you manage your stress, and the what is stress? And stress, actually, it can be a good thing, and in fact it is a good thing, because it's not compatible with living if you don't have any, believe it or not. So we have this aspect that we first tackle that before we look at hormones and all the other stuff related to how do we lose this belly fat, how do we manage menopausal symptoms, do we really need to take bioidentical hormones or BioT or whatever the latest is they're being called, as far as trying to rebalance your hormones. I will say, women who take it, man, you will feel better because you're obviously supplying it. However, it won't correct the problem. The problem is still there and will continue to be there until you work on these other areas. So I'm going to just suggest one other thing, which most people are not aware of, but which my mentor taught me, which I had observed in my patients for years, and without really knowing why it was. But the body are these organs that produce estrogen over a 3 of when procreation is no longer a necessity. What my observation has been, and what my mentor taught me, is that they actually have a secondary function. And that secondary function is one that's called a spiritual awareness. And I often observe women, when they get into menopause, and of course, we can call they're empty nesters. Their children, are no longer, we'll say, part of their responsibility. Their children are looking after themselves, or they're doing their own life. And so, that sort of comes out of the equation for most women by the time they get to a postmenopausal age. But they're looking for something, and it's like, is it just by fluke or by accident that they start thinking more about whatever? And spiritual awareness doesn't mean they start going to church, or they take up a specific religion. It's more of an understanding to me of a belief in a higher power, that there's other components, and we could call it just inherited wisdom, wisdom of the elderly, type thing, just from life experiences that allows them a little bit differently. But what start taking some form of internally from the aspects of, or whether it's a cream, or whether it's a patch, or whether it's vaginally, they don't have, it seems, the same opportunity to reach this heightened spiritual awareness. And I'm not going to be so bold to assume that if a woman is taking external hormones, she would never be able to reach that, which is not true, because definitely they can. It's just my observation that in my practice, that I have found that some women seem to be there much more easily than others, and whether they choose to or not. So I call it the gland of secondary usefulness, or their secondary purpose, and we call it the gland of spiritual awareness. So menopause is a time that's not a disease. It's a very healthy transition with we'll say, a different purpose of the reason that we're on the planet, of what it is that we're to achieve, to allow humanity to survive, etc. And so, yes, we have hormones, and yes, you can support it palliatively. But I think one of the challenges is we don't, there's not enough effort in the medical field to actually support the other underlying areas that need the support, AKA the thyroid and the adrenal most appropriately, playing a big role here. We talked about the important, hypothyroid, low hormones that we measure to measure your thyroid function. Why does it start getting higher? Well, it's because it's working harder, because the thyroid and the adrenal have now taken up this partnership to basically try and support the energy required in a postmenopausal woman to carry on every day what it is that she's attempting to do. And it just says, look, I have to work a little bit harder. So you go to the doctor, your TSH is up and says, oh, your thyroid needs some support. And once again, that may be necessary to take some thyroid support, or we can do some nutritional support, and with a variety of different types of things. But all that type of thing will require, some support from your doctor or from your biological practitioner, who will be able to share with you, some other ideas, whether they're homeopathics or whether they're acupuncture or whether they're hands-on or massage or, healing touch or whatever. So there we have, 101 different tools to support all those types of changes, which obviously are sort of beyond the point of this podcast. So that hopefully wasn't too long-winded, but hopefully it was a rather insightful and helpful, and will help you understand that there are other things that you can do with your doctor's support to try and support any other type of symptom that you may be having menopausally. So, did that bring
Wow.
up any questions, Julie?
Wow, that was a lot of info, but I learned a whole heck of a lot. But I do have a couple questions, because basically one thing you talked about was lowering your insulin levels to, support your adrenals. And so do you have any particular activities that you know of that actually help support lowering your insulin levels other than walking in nature? Basically all the things that we talked about in our podcast, I'm going to assume.
Obviously, it's there's a lot to be said about basic treatment guidelines, and
Right.
so nutrition, has a big role to play
Sure.
in there. But there are, there's a few different, there's a few different supplements that people will use. We can use things that will support glucose metabolism, conjugated linoleic acid, which has been shown to be particularly helpful. It's a type of question, even though I could generically answer it, it really is, it requires an individual answer.
Sure.
Because there's so many different options and so many different possibilities for what's going on. We know that, for example, melatonin and will support getting melatonin, which feels out it's about sleep. But the important thing, which is actually a hormone I didn't mention, but it's actually part of this picture too. In fact, all these hormones are a picture of it. Sure. I did mention the idea of leptin. Leptin is one of the hormones which will inhibit cortisol. And so once again, we're trying to balance this cortisol out. And melatonin has the same rhythm as leptin does. So we can use carnitine as a nutrient that will help lower insulin levels. As I said, the conjugated linoleic acid, essential fatty acids, which is why we continue to cycle seeds and oils and that kind of thing. Curcumin, which is used, dietarily in India routinely, but we're also using now commonly as a supplement for just general inflammation. And unfortunately, many people at this point often will have high blood pressure, and so their doctor has told them to limit salt intake. But limiting salt intake will increase your insulin because it increases sodium retention. So it's a vicious cycle when you start looking at all the pieces of the puzzle to try and individualize it. I mean, these are all simple type things that could be helpful, but I would say these are the types of things when you get into discussion that really have to be individualized.
Right.
So the biggest thing is do basic treatment guidelines.
Okay. Yeah, because I mean, like you said, it does have to be individualized, but that's why it's so frustrating, because you can't just pick up a book and be like, okay, I'm going to follow this protocol, and it didn't work. And then you're like, now what? And, now what is basically you have to really take a look at so talking about the adrenal gland. So I am someone who's struggled with chronic fatigue and adrenal gland. I have a history of chronic, just my adrenals have done a lot of work, as you know, with all my swimming and all of my over exercising that I did in my life. So am I someone, I'm not menopausal yet, but am I someone that's more susceptible per se? Or so is there something that I can do now that I'm before, I hit menopause that I need to work on more than others, or just keep focusing? Like I should be definitely like obviously seed cycling and doing my EFAs and whatnot, and managing my stress and doing the basic treatment guidelines. But is there anything else I can do to support my adrenal glands now?
Well, as I said, the number one treatment for everyone for adrenal glands is schedule and routine. And so you know, what you're doing now is exactly the things that you need to do. And, you can look in your past and, 4 hours of swimming in college and, all that kind of stuff.
Yeah.
It's like, yeah, it allowed you to get where you need to be. And you have more reserve when you're younger. And one of the challenges as we age, we have other factors. And it's not so much swimming, it's 3 kids and it's a family and it's job. And I mean,
Yes.
it's the other things that come into life that we talked about that, in our previous podcast where we talked about play and fun and that kind of thing, where we have all these extra responsibilities. So you can maintain uh, and support adrenal gland. And one of the great things about the adrenal gland can recover to a normal level. And one of the hormones we know that goes down as we age is DHEA. It's
Mhm.
commonly felt to be, sort of a longevity type hormone, but that's another one that we measure routinely for our patients. And as DHEA is getting lower, it seems reasonable to, especially if cortisol levels are low, that we support, DHEA, we support pregnenolone, we support cortisol with herbal supplements or nutritional supplements that are most appropriate, once again, for that individual person.
Okay. So supplementation nutrition is really what needs to get on point to support this then.
I think in our society, we can say, well, you can do it with food. I mean, we know that vitamin C and vitamin B and zinc, and there's a number of supportive nutrients which dietarily. However, generally speaking, people can't eat enough calories to be able to get high enough levels of these vitamins to rebuild, to make adequate levels of these hormones. So yes, it is regard. But is it absolutely? The person was incredibly diligent and every duck was lined up in the row. You may be able to get by without it, but I commonly recommend, some form of, whether it's an herbal remedy, whether it's a homeopathic remedy. Obviously the routine is the most critical thing that will be supportive for what they need.
Yeah, it's funny you say that because it's something that I'm taking a neurology course right now, and in order to help support uh, yourself and your body going into stress or survival mode is predictability of movement and predictability of outcome. And so having that routine is super important from a neural aspect as well. So um, yeah, I just want to add that part. I had another question. It popped out of my head because that just came in because I've been really talking a lot about predictability of movement. So it's like what can you do every day that is predictable and easy and that'll make it um, less stressful for you. So stress management is obviously a big piece of the puzzle with this as well, right?
Stress management, and the one other piece of stress that I'm actually about to give a presentation on within the next couple of weeks on stress is the your perception of stress. Stress is
Mm.
everybody. If somebody's perception of stress is that it's bad, it will be. If there was a study done at Harvard 10 years ago, basically showed that when they put people into two categories, they could have equal stress, but one category was it's a necessity, it happens in life, we all deal with it, but I'm not going to let it bother me. This other group was like, yes, it's a necessity of life, but maybe it's going to kill me because it killed my grandfather. Yeah, yeah, whatever they say. And so when they followed these people for many years, there was a 40% higher incidence in the people who believed the stress was bad with cardiovascular death. So I look at heart disease in this country, and we always talk about cholesterol and high blood pressure, and yet I would almost guarantee that 90% of the patients that I have personally seen over all these years who've had a heart attack, their cholesterol, they're often on statin drugs, they're often on high blood pressure medications, yet they still had a heart attack. And it's because they almost always, to a person, had some type of a stressful event that they had trouble dealing with, that they felt that they couldn't get out of, and they weren't accepting of it, and they just kept around and around. It was the stress and the research that has been done. And there was a TED talk that basically talks about the concept of stress and showed some pictures of the amount of vasoconstriction that happens when our body is under stress. And in fact, I believe that many people, in addition to cardiac and kidney issues, which often is what we tend to think about with high blood pressure, but in my experience and my practice, by doing heart rate variability on people, we see that their imbalance of their sympathetic parasympathetic system has a much greater impact on their stress. And when we support their nervous system more so than their cardiovascular or kidney, their blood pressure actually goes down into normal ranges, even without taking a high blood pressure medication.
Crazy. Actually, like again, in my neurology course, something that they were talking about is in terms of how we measure blood pressure. So they were talking about for assessment wise, from a movement perspective, is that depending on how the brain is communicating with the body, that you should take blood pressure on both arms because it can be different on one side versus the other because you could have a brain stem or a PMRF. It's a part of the brain of where we experience pain. And anyways, super fascinating. And so now I'm like, anybody that takes their blood pressure, just a little side note, make sure you take it on both sides because it could be different on one side versus the other. And if it is, then it's basically it's a brain issue. And so that goes along with the stress levels you're talking about, Dad. But actually, I remember my question from before. So women who are struggling with this menopausal belly or want to support their hormones, do you suggest intermittent fasting?
Intermittent fasting is something that has been shown clinically in my practice to be very successful for many people, but not 100% of people. And so that has to be done intermittently. And yes, it is the type of thing that has also been shown to be helpful for weight loss. And it's really because of the issues that we've just been talking about for hormones. It's not necessarily calorie restriction. You need the same number of calories, just that you're eating at between, let's say, 11 in the morning or 12 at noon and 6 or 7 in the evening. And so that which basically gives the body about a 16-hour physiologic break from having to shove all 40% of your blood into your digestive system in order to digest this meal, within the 1 to 2 hours after you actually were eating. So there's a lot of things happening on a physiologic level for doing that, and it helps to balance other hormones. So that is definitely I commonly recommend that for people to see whether or not they can do it, and if they can, that's wonderful. If they can't, then we come up with a different solution.
So it is okay for women to, because I mean, there is controversy on should women intermittent fast and should they do it, you know,
They
as
shouldn't
as
inter they
sorry,
shouldn't
go ahead.
be intermittent fasting if they're breastfeeding or there's some other healing aspect going on. But from
Sure.
a blood sugar perspective and a weight perspective, an insulin perspective, and a leptin perspective, it actually has been shown to be it can be very helpful.
Okay. So is there a time frame that like they only do it for like 3 months or 6 months, or can they do it as like a lifestyle?
They can do it as a lifestyle. If they've done it for 3 months and are tolerating it quite fine, I see no reason that they would not. Um, they shouldn't continue. I think it's a In fact, I have many people who've been doing it for years already and have done it quite successfully.
Okay. And so what about those people who have been doing it for a long time and quite successfully, but are now struggling with like cortisol or the, cortisol belly or, whatever belly everybody's talking about, they're holding weight because of stress levels and whatnot. Would you recommend that they continue or change it up?
I can't give a specific answer to that. So, if intermittent fasting has been, a part of an individual's life for some period of time, and they're still having issues, whatever their issues are, that all that suggests is that there's more pieces to this puzzle.
Right.
The fasting and insulin and leptin and cortisol is a piece, but I consider health to be like 1,000-piece jigsaw puzzle.
Sure.
And my role is to try and identify as many of those pieces of the jigsaw, and then try and figure out how do they fit together so we can actually see what the picture is. And the more pieces of that puzzle that we're able to figure out, generally the more successful the individual will be in getting closer and closer to their level of optimal performance.
Awesome. Okay. Well, that was super informative. I learned a whole heck of a lot. But we've talked a lot about stress. So in our next episode, guess what we're going to be chatting about? Stress and steps to manage it and stress resiliency. And it's a big, big topic. And I really look forward to having a chat about that. But do you have any parting thoughts or any other tidbits that you'd like to share about menopause?
Don't consider it a disease. Don't consider it that it's that woe is me. I'm getting to that age, and I've heard stories of some women of how terrible it can be. It actually doesn't have to be that at all. Like, it's, in fact, for many women, is one of the most freeing times ever in their entire life. So I would encourage you to look forward to it. I would encourage you to incorporate these things over what I believe was now 14 of our podcasts. That incorporating those things into health will allow you to live well into a wise old age.
Absolutely. Well, it's funny because you just mentioned, like how we perceive stress. If we think stress is bad, then it's going to, have that effect on our body. And if you think menopause is bad, well, it's going to have that effect on your body. So, just think about
Absolutely.
that. Just think about that for a little minute. And then, yeah. So there is hope. There are options. So hopefully you enjoyed this podcast. Thank you so much. And again, if you have been listening with us for the last 14 episodes, we appreciate your support. And if you have any comments or any questions that you'd like us to discuss, please contact us because we'd love to discuss them as we want to keep the connections going and want to keep the conversation going. So thank you again so much, Dad, for all this super helpful information. And I look forward to talking about stress in our next podcast.
We'll talk it soon.
Welcome to Connecting with the Toms podcast. I'm your co-host, Julie Tom, a trauma-informed movement specialist.
I'm Dr. Dick Tom, a biological medicine physician. We wish to share the untold truth about health and fitness industry based on our combined 70 plus years of experience. We want you to connect and feel empowered in your own mind and body by interacting with each other.
This show is about connection for you, for us, and for the world. This is Connecting with the Toms podcast. Let's start connecting.